In this episode of At the Vets, a last chance surgery for Mingyur the Pug.
We are willing to try alternative treatments for Mingyur's cancer.
A final goodbye for Junior.
Is having to put an animal down easy? Answer is no.
And a late night emergency at the clinic.
Excuse? This.
This is Terry. He is 10 and he's a very, very big Singapore special. Okay, good boy. We were at the dog park and playing with a tennis ball. He was running for it and he kind of just slipped and fell. The moment he got up from that, he was like walking on 3 legs only. He actually tore the equivalent of an ACL and he's in to fix his knee because the bones are rubbing against each other.
Hello.
Hi.
All right. Okay, good morning. So, are you ready?
I don't think I can be completely ready, but yeah.
Yeah, I know, right? Just to recap, right? We will be cutting the bone in a curve and then we'll be rotating it a fixed angle and then we'll be putting some implants in.
Okay.
Okay?
Yeah.
Of course, there would be complications with surgery, right? You can't predict what's going to happen.
Yeah.
Worst case scenario, the dog will still have a limp. Best case scenario, he's going to walk like normal again.
Okay, I just say bye to him.
Okay, you take a time.
Okay.
Okay.
So the day we met Terry, we were not actually planning to get a dog. My family and I were just driving past where SPCA was and we decided to just go in and have a look. We saw all the dogs and Terry kind of won our hearts over. He was really cute and active. We automatically fell in love with him. And then we left because we were not planning to get a dog. But on the way home, the only thing that was on our minds was Terry. When we got home later on, my brother and I kept asking our parents, and finally my mom kind of caved in because she fell in love with Terry as well. And the next morning itself, we went in to adopt him.
So we're gonna put this cone on, okay? Good boy.
Very good.
You're a good boy. Big dogs are easy in the sense that the bones are bigger and you can see what you're doing much better. But if you have a complication, everything will be more drastic and more intense. We're just gonna wait for the blood test to come out and then we'll be able to proceed.
I'm happy that he's finally getting something done to fix his leg. But this is the first time that he's not going to be at home with us. So yeah, we're all really worried and anxious.
The blood test will reveal if Terry is healthy enough for surgery. Meanwhile, over at the Animal Wellness Center,
Hi, Dr. Lai.
Hi, Kelly.
Dr. Jean-Paul Lai is seeing a much tinier patient.
His name is Mr. Bob. My son has 4, so he's the most tame and very good boy. You call him, he will look at you and come to you.
Oh, how old is he?
I think about 2 plus. He has tumor on the stomach.
You know, these tumors you can't touch because they're full of blood.
Okay.
Can't cut, you can't tie because it will just bleed everywhere. This is natural. It's about to go. 2 years is about the average age of a hamster. So I hope your son is dealing with it. Is he dealing with that?
Not ready yet.
But you have to talk to him.
Yeah.
It's only a matter of time.
It's really heartbreaking, yes. Because hamster is also like one of your family member.
Mr. Bob is out of options. But Mingyur the Pug has come to Dr. Lai for a last-ditch effort to save his life.
Mingyur is a pup. He's 13 years old and 7 months. He developed a mast cell tumor, which we operated on his chest in January this year. 4 months later, he developed 2 more at the armpits around the lymph nodes. We did 4 rounds of chemotherapy every week in the month of June. but then it grew so big, so obviously the chemotherapy doesn't quite work on him. So we came to Dr. Lai because we are willing to try alternative treatments.
Oh, my sweetheart.
He's like a bit soft in the legs now.
To excise Mingryu's tumours, Dr. Lai wants to attempt an uncommon procedure: cryosurgery.
Cryosurgery is where you use extreme low temperatures to kill a tissue. And in this particular instance, the tissue is diseased or cancerous. We'll freeze it with liquid nitrous oxide. We'll thaw it with very warm water. It's called a heat shock. So it kills the cells because when you freeze and then suddenly thaw, the cells rupture because all the icicles in there will break out.
What will happen?
The whole thing will just shrink.
Yeah.
And for the bigger ones, some will burst open, some will just dry up. It varies for different dogs and different types of tumors. I'm the only veterinarian that does extensive cryosurgery. There's not a lot of equipment for sale these days for vet use, so a lot of vets don't know much about it. In many cases, it is more effective than normal surgery. It's less invasive, you're not cutting, and very often you don't need a general anesthetic.
When we came here, we already know we're going to try a lot of different things. Since chemo doesn't work, right? We had him for almost all his life, right? Just like family, you know? You just try everything that you can for them.
One, two, three.
Terry, the Singapore special, has been limping for a month now due to a torn ligament. A knee surgery could get him up and running again. In dogs, the thigh and shin bones connect at an angle. Terry has torn the ligaments that hold them in place, causing the bones to slip. In today's surgery, Dr. Wu will reposition the top of Terry's shin bone so the thigh bone can sit flat and prevent it from sliding.
So I'm just having the x-ray up later here to make sure that all the measurements are done correctly. I became a vet because I wanted to save animals. My philosophy of being a vet is to make sure to do your utmost best to treat and make the pet better. So we are going into the knee joint and remove any bits and pieces that could still be, dangling, because that potentiates the inflammation. Cutting. Just basically cleaning up the area, removing any damaged tissues. The second part of the surgery would be the tibia PLATEAU leveling osteotomy procedure, where we're going to expose the top part of the shin bone and make our measurements and make the cut.
Dr. Wu needs to get the angle of the cut exactly right. Otherwise, the bones will not fit together properly.
Cut has been made. We're going to put a final stabilization with this plate here, which is a very strong plate made of titanium. It will hold these two bones in place. The surgery is almost done. We managed to shift the bone in the orientation that we wanted it to go. We're just going to close up and make sure we have a good seal in the joint. So you can see these are the post-operative x-rays. So this is the bone where I cut. We use this little plate to hold everything in place. I think the screw positioning is all very good. I'm pretty happy. It's a common big dog problem because they're very heavy, and then they run around, jump up and down, they will twist it and it will just rupture the ligament. Actually, he was slightly overweight. Obesity and dogs are predisposed to many things, one of which is something like that, a cruciate injury. So many other things like, diabetes, kidney issues, all stems from obesity. So if you love your dogs, you want to feed them, you see them eat, you're very happy, but think about the other side. If they are too obese, you might be causing more harm than good.
While Terry's operation has gone well, over at the Animal Wellness Center, Mingyur's cryosurgery has been put on ice.
Dr. Kieran is a specialist anesthetist. She's concerned about the size of the tumor. If you destroy it too quickly, and if it's too massive, it breaks down, and they release a lot of histamine. These histamine are toxic to the body, and the dog literally can go into shock. So we're offering her some alternatives. We can try natural killer cell therapy, which is the anti-cancer cells produced by your body. We have managed to harvest natural killer cells from healthy dogs that are free from disease.
Natural killer or immune cell therapy uses a special type of white blood cells to destroy cancer cells in the body.
My best case scenario is the tumor mass themselves may start to shrink and the appetite would improve.
Okay, come. Okay, good boy.
So Dr. Lai recommended immunocell therapy, the NK cells therapy, and we're going to do that. You take it as it comes, lah. You can't do anything else. It's just part of the life cycle.
Nearby at the Gentle Oak Veterinary Clinic, an elderly Maltese, Junior, is also near the end of his journey.
Unfortunately, he's got a very bad case of pancreatitis. And he's also a very, very old dog. He's got a heart condition that's quite severe. So unfortunately, there's very, very little that we can do more for him from a medical standpoint.
Junior has been 73-year-old Madame Tong's faithful companion since she adopted him 6 years ago.
So we're gonna send him home, spend some time with Auntie, and yeah, we're going home. That's the first time we made a sound for a while. It's always hard because we also have to consider, the owners, what they can manage or not. And Auntie herself is not in good health. 啊，你头又痛啦？啊，头痛，天天痛啊。为什么呢？不好睡。哎呦，这个礼拜没有好睡。啊，他生病了，我就比较辛苦了。
She was thinking of just putting him down while he was here because she's left him with us for a few days. But it just felt like Junior is somehow holding on just to see her again and hopefully get to go home. Is having to put an animal down easy? Answer is no. For me personally, it's never easy. One question I always get from my clients, just when should I do it? Is today the day? And my answer is, there's no right or wrong time.
希望他能够在睡梦中去世，在梦中不会受太大的痛苦了，安详的离去，安详的去世，最大的希望。 如果在家里去世，我就安心了。
Some days it just really doesn't feel like today is the day where he or she is ready to go.
好，再戴个围巾啦。哎呦。
The look the animal give you in life, it's almost like they go, Doc, I know soon we have to do this, but something's not finished. My job's not done, or Mom's not quite ready.
Death is never to be taken lightly because the grief of losing a pet is actually no different to losing a family member. It's exactly the same. I remember this particular patient, this dog has been her companion, and suddenly it collapsed one day. And she did warn me, if this dog died, she would likely take her own life. And it was the greatest stress for me because I half believed her. You know, that stuck in my mind. It reminded me how important these pets are to people. Very good patient. They're not just a dog or a cat. Even amongst vets, I think very often we forget that.
It's 8 p.m. and there's still a long line of patients at the Advanced Vet Care Veterinary Center.
So I'm going to check on some of the patients in hospital at the moment. This poor little cat is a bit anemic, so the blood count is very low. Out of a 5-day work week, at least 4.5 of the days we probably end up working at least 2 or 3 hours overtime. We are the only ones in this area that is open 24 hours, so a lot of times it gets crazy busy after like 9-10 o'clock, and it can be very unexpected. Pulling these long nights, you know, it does take a very big toll. I will come back for dinner and I haven't seen my kids for the whole day, and I'll just say hi, you know, and then before I know it, I get called in again. Sometimes I tell them that I can't do it, and I get so guilty that I will just call them back and say, okay, never mind, let's ask them to come in, I'll do it. Usually the cases that come in at night, they are usually considered emergencies.
Just like this young bird that has come in a very serious condition.
The parrot's head got stuck at the door as the owner closed the door. Yeah. My concern is more whether there's any trauma to the brain. She's rocking to the side, she can't really stand.
She's making sound, I mean, she's responding.
You have to prepare for the worst because birds, they are just very fragile creatures and damage to the brain. There's a chance that they might pass away. We recommended keeping the parrot here in the hospital, but the owner declined the hospitalization. They just want to bring it home now.
As the night shift wears on, another patient comes in for emergency care.
It's a bit cold. Ooh, what's that? It's got a lock or something.
Yeah. When I squeeze the valve, got pus come out.
Oh, maybe. Oh, you poor thing. If it's a worm infection, then it's very, very bad because the pus and the bacteria is stuck inside and there's nowhere to go and only can depend on antibiotics. You know, if it overwhelms the immune system, then the poor hamster is probably going to pass away. A hamster could range between 20 grams to 40 grams at most. So they're very sensitive to anesthesia and they tend to have much more difficult recoveries. The owners did not decide on surgeries. They went ahead with the option of getting antibiotics to try and see how things go with that.
Close to midnight, a pair of stray cats are brought in for treatment by the Society for the Prevention of Cruelty to Animals, or SPCA.
What happened to you? SPCA, they have a hospital, but at night the hospital is closed, so if they have a rescue in the area, then they will bring those rescues here just to stabilize until they can see the vets the next day at SPCA. It's a feral cat. So we put a cone on just to protect them and protect ourselves sometimes because sometimes they get very aggressive. That is part and parcel of a daily work life of a vet and a vet tech. All of them will have scars if you look at their arms. We were quite fortunate that this cat is actually quite nice about it. Okay, it looks like a very big open wound on the bum. It's probably a cat fight wound. Sometimes when they're running away, the other cat claws the back end, and because their claws are so sharp, it just rips, make a big gash. We're just gonna clean out the wound and then give him some antibiotics, right, and put some bandages on and send him back to SPCA for ongoing management.
Just as the first stray is patched up and put back in its crate for transport, the second cat suddenly stops breathing.
Is it okay?
Okay. We need oxygen.
Just intubate. Aiyo, look at that. Still beating? Still beating? I need a, give me a 3 ml syringe. Zach, come. Pump, this. Don't let him speak, don't let him speak. Cough down. Okay, just keep on being, it's okay. Just, got heartbeat, no pump, just breathe. Not so fast, not so fast. 1 every 5. The cat came in with some breathing difficulties, and as a result, the heart stopped and we had to commence resuscitation. Keep pumping, don't stop. We were quite quick, we intubated and we started resuscitation. Pump.
Yeah, we get a heartbeat.
The heartbeat?
Yep.
The heart came back. But unfortunately, the heart stopped again. No pulse, right?
No pulse. Just lost it.
You gotta pump again. What do I do? Okay, it's gone. The heart has stopped already. When we took out the tube, there was a lot of infectious material like pus and mucus. So I think the cat probably has been suffering from a very bad pneumonia for quite a long time. It's kind of disappointing, really. We have to try to save all of them, but some of them are really quite sick by the time they come in. Oh, that's very sad. Every time when I face death at work, it's never easy because you start second-guessing and you start blaming yourself. When you're at home, you have your time to think about what has happened throughout the day, and then you start thinking about the case again. There's definitely that few patients that always linger in your mind.
I find that, strangely enough, humans are better when it comes to the concept of another human being having to pass on versus the concept that a pet is to pass on. When someone brings a pet in, a lot of times they will think that just because it's seen the doctor, it'll be okay. I wish most people will realize that vets can't do everything. We don't walk on water. Sometimes, from a medical standpoint, there's just nothing more you can do.
In the next episode of At the Vets, Dr. Lee hoofs it to the stables for an unusual visit.
It's actually good to be out here, getting in touch with the horses again.
Things get hectic at Dr. Wu's clinic.
Some of them are workaholics and they just keep going and going.
Having lost one leg to cancer, another of Kira's limbs is now at risk.
For most vets, I think it's easier just to cut it out.